We saw the Wall Street Journal reporting on Friday that the federal government is going to release findings of causes for autism in the coming months or so. That sent a shockwave through shares of Kenvue, for example, because it's likely, according to Wall Street Journal reporting, to say that over-the-counter pain medicine with acetaminophen, which is the active ingredient in Tylenol, may cause autism. So the question is, when are we going to see those findings? And can you speak to this Wall Street Journal report?
Look, I think within a month we're going to have our report on autism because it's a massive priority for this president and this secretary. And they've said, look, we have an epidemic of autism in the United States. Nobody's talking about the root causes. We not only want to talk about root causes, but what parents can do. We've got millions of kids with autism in the United States. 1 in 20 boys in California. So we've got to bring attention to this issue. Now, the Wall Street Journal reporting on Tylenol, that was incredibly premature. We haven't even written the report yet, so I don't know how they can put that out there. But there was a Harvard study that looked at autism and Tylenol, and perhaps they were speculating that it was that study that would be incorporated in the report. We're looking at everything. And Tylenol is not the central piece of the report, but we are looking at every piece of data.
But there will be balance in whatever determination you make, because when people see the Tylenol thing, you know, we talk about pregnant women. I mean, most doctors tell them that's the only pain medication you're supposed to take when you're pregnant. So if that becomes a risk, or you determine that that's a risk for autism, is there going to be an alternative that can be proposed?
Well, first of all, we didn't put out there that Tylenol causes autism. We're reviewing the data. We haven't started the report yet. Most fevers in kids do not need to be treated. You know, in the medical field, every time I get a call, hey, this patient has a fever, I went ahead and treated them with Tylenol. Why? Why are we doing that? It's only in a small subset of patients where you actually need to treat the fever. The fever is the body's natural way of ridding the infection. And when you treat a fever in a young, healthy kid, there's research, including out of my former institution, Johns Hopkins, it can actually prolong the illness with chickenpox. That's a study out of Hopkins. So we need more clinical appropriateness with these medications. I think you're going to see some amazing things that have not been discussed in this report on autism.